Welcome to the Regional Health Solutions podcast, powered by Statum.
We're your hosts, William Munt and Jaden Frame.
Welcome back to the Regional Health Solutions podcast. I'm William Munt. I'm here with Jaden Frame, and we're both thrilled to be back for Season 2. Over the next 6 episodes, we're continuing to do what we set out to do, which is shine a light on the real practical solutions that are being developed and deployed across Australia to tackle some of the most pressing challenges that are facing our health and aged care systems. We've got a great lineup of conversations ahead. Kicking us off today is Graham Russell, the founder of Talius. Talius is a real-time health monitoring platform that's doing something genuinely exciting in the aged care and home care space. What Talius has built is essentially an operating system for care. It aggregates data from disparate IoT sensors, wearables, and monitoring devices into a single platform. It uses AI-powered algorithms to move healthcare from reactive to proactive. So instead of waiting for a crisis, Talius is designed to identify that something might be wrong before it actually becomes one. With partnerships with some of Australia's biggest aged care providers, Graham has a front row seat to the challenges and the opportunities in regional healthcare. So of course, Jaden and I were very keen to sit and hear his insights into the space. We're also pleased to share that Statum and Talius are now working together as partners in the Darling Down region as part of our technology pillar. This episode gives you a real sense of why we're excited about that partnership. So let's get into it. Here's our conversation with Graham Russell from Talius. Graham, thanks for coming on the Regional Health Solutions podcast.
Thanks, Will. Great to be here.
Mate, maybe just give us a quick rundown of your background and the pathway to where you found yourself in the seat that you're in.
Well, by trade, I'm an electronics technician. So I actually started on the tools when I was 19 and worked in predominantly the electronic security industry, installing sensors and so forth in banks, and then financial institutions, and then businesses, and then homes and so forth. We then started to get a number of inquiries and calls from business owners that were having challenges inside their businesses, usually particularly around workflows. And those workflows were, Graham, this is not being done, this person's not doing what they're supposed to do, how do we stop it? And I used to get called in particularly when there was obviously a big expense around that. So, someone had died, someone had been injured, some, huge expense, some mistake. And that was usually things like someone hasn't checked the turbine on the power station, someone hasn't checked the drugs fridge, and we've lost all of the medication, IVF clinics all across these different sectors. And we used to implement sensors in a way that would actually ensure that that was being done. And that was sort of my evolution into healthcare. So I'm starting to do work in hospitals and aged care.
When you look at regional and rural healthcare, where do you see that heading in the next 5 to 10 years under the current structures and processes? What's your thoughts on that?
Well, it's not politically correct, but I'm obviously greatly concerned. Is that obviously living in regional Queensland myself and seeing, and having the fortunate part of actually working in the cities, but I see the same problem in the cities as the regional areas. It's all about people, and we don't have enough resources. I'm not seeing that we're actually making any real change, and it's would probably reiterate is that there hasn't been any real adoption to innovate or change how we're doing things. And, as I was saying, it's a definition of insanity if you keep doing what you're doing. And, the health systems are currently under enormous pressure currently, and with the ageing population coming, the lack of skills, I just see this that we are going to face a very, very tough 5 years. I read a article from Bernard Salt, the demographer, the other day, and I think he went a little bit over the top, but he said that this will be the greatest crisis to humanity ever.
Oh, wow.
He's saying the numbers that are coming will absolutely beat everything else that we've ever faced. I think the Black Plague might have him on that, but the thing is that,
yeah.
But he is talking about that what I'm experiencing now in hospitals of 110% capacity, we're putting safety solutions in for frontline care staff that have been physically and verbally abused because of wait times, lack of response and resources, who are then resigning. So, and we've got already about like 7,000 or 8,000 shortage of nurses. We can't get doctors in regional areas, like the wait times. I know you all know this, but it's just, I think it's probably important for the listeners to really see is that, you know, whatever you do, stay healthy.
One of the most common questions we ask all our guests is what the single biggest challenge you foresee is facing rural and regional healthcare today. And I'm going to put some things together that you've gone through. So there's catastrophic events that you alluded to earlier that you were brought in on, which is a manual process.
Yes.
You're talking about a people shortage and an overwhelmed system who are responsible for those manual processes. And probably without putting the words in your mouth and having seen a number of Talius's presentations and knowing that we're now a partner, I know that manual process is what you see as the villain.
Yes.
So again, without putting words in your mouth, is that what you foresee as the single biggest challenge facing everyone in every industry today? But let's specifically talk about healthcare. How do you frame that problem and what do you foresee? Let's start to talk about some of the solutions as well that Talius is looking at.
Well, I think the biggest problem is actually preparation. We are not prepared. And we knew it was coming for 20 years. And we haven't done anything. And it's too late. The sharks are circling. We haven't got enough beds, enough people, or enough money. So what is the alternatives? I think it's like any challenge that we've had previously is that it usually leads back to technology. And this is an industry and a sector, or, you know, the healthcare sector has been very averse to technology because this is the way we've always done it. And to that manual model is that there's nothing wrong with the manual model. It does work. It's just very repetitive. There's very poor data capture. It's very expensive. And the problem is that when you do processes like this that are very repetitive, also becomes familiarity creates complacency. And that complacency creates the mistakes. And this is where we're now going, right, well, look, the first person's making a mistake. Let's get another person to check that person's work. So we now become even more inefficient in the labour resources that we have. And there's also been a number of key things that have, I suppose, happened over the last 3 or 4 years around technology, is that the incredible increases in connectivity. So we're all seeing it from our cars and phones and homes and so forth, from Starlink, which has been transformational for rural and regional areas. And the big thing is that what Talius is about is actually trying to create real-time information and data. Like Talius is really a real-time health monitoring platform or an operating system. So instead of waiting for a manual process which goes into a notes or a report, which is obviously very helpful, but when we were so time poor, we can't even look at the notes. And so I often refer that to a little bit like the black box in a plane. All that data's going into that information system and it's great. But like the plane, we don't look at it until the plane's crashed. And then we say, where did we miss it? Whose fault was it? And I can blame someone.
So stripping this back to the basics, perhaps for the listener who's joining us who has never heard of Talius before today.
Sure.
How would you give the elevator pitch for Talius and try and flesh that out a little bit for them? What does it do and what have you done? And go a step further, what innovation is Talius bringing to try and tackle some of those healthcare challenges?
So what we identified is saying like the manual processes is the problem. Second thing is that data is obviously very important. We're already drowning in data. There's already overwhelming amounts of it. What Talius has done is actually brings in real time all of that data together and aggregates it. Then we analyse it and then we create an action out of it. So to dumb that down a little bit is that we basically bring in a lot of cases, sensor data. So for example, from wearables, so from sleep monitoring, from falls, from glucose. And this is the part of the problem is that you might have an amazing, the Dexcom glucose meter, which has an app. Reads your glucose and creates an alert, which doesn't go anywhere. Okay? And then there's another one for your pacemaker. And there's another one for your sleep. And there's another one for falls. And there's another one for nurse call. And there's another one for... And you're seeing where I'm heading with this is that it's all disparate and none of it's together. And this is a problem for the healthcare space is that how am I supposed to scale this across... So Talius primarily started off in home care. And so we saw that I suppose a bit of a personal mission for myself is after spending a lot of time in hospitals and residential aged care was how could we empower people to stay at home longer? And obviously still respecting privacy and dignity, we utilised a number of IoT sensors. So for anyone who doesn't know, IoT is the Internet of Things, which are tiny sensors that collect tiny pieces of data. So instead of a human coming in, collecting and driving to a home and collecting all that information, we have a number of disparate IoT sensors. So from a Apple Watch to a sleep sensor that sits underneath the leg of the bed to some sensors that will collect activities of daily living, vital signs, weight, movement, and also in and out of the home. That information is compiled in the Talius platform, and then we partnered with CSIRO a number of years ago and worked with the eHealth division out of Queensland, who patented a special algorithm that actually analyses that data. And that data algorithm actually will create a pre-alert. So identifies as that this person is struggling. And probably I'd like to reiterate is that one of the key parts that I've seen for healthcare and across most of primary services is that we react. We only react. We're always the ambulance at the bottom of the cliff instead of being the options of how do we actually stop this happening. Listen, you're always going to need the ambulance and you're always going to need that reactive response. But how do we actually identify an issue before it happens? So from there, Talius has basically developed a B2B2C model. And so, really great to be here today and having Statham as one of our platinum partners in the Darling Downs area to help support this technology adoption. But we have, over the last 5 years, partnered with probably half the top 10 providers. So Bolton Clark, Ferris, Anglicare, Royal Freemasons, Benetas, keep going, Uniting. We're in New Zealand working with St John's Ambulance over there. So we've already got about 50,000 subscribers now on the platform. And we're aggregating all that data, creating a proactive alert, and then identifying care teams on where that support. And this is to the point, Will, what you're saying is that how do we triage and utilise the resources, the limited resources we have, to actually get them to respond to the right place at the right time.
That's one of the biggest selling points, in my opinion, is that disparate systems creates multiple dashboards and fragmented information in a hospital or an aged care facility or whatever organisation you represent. And as an exec, ex-exec on a private hospital, you'd often go down that branding commitment, and then it would be a barrier to entry. You rust it on to Dragar or Mindray or GE or pick your poison. And to paraphrase what you were saying, if I got this right, it's pulling that fragmented data together agnostically to create a hospital or an aged care dashboard where you don't have to reactively treat or make decisions. You can proactively manage what data is out there so that you become more efficient, and it abolishes those manual tasks alongside that. So that's a huge selling point. I'm going to go off piste here a little bit. I'm interested what role AI has to play in this. We're living in the AI revolution at the moment. Is that starting to be smuggled into the platform, and what impact is that having at the moment?
Yes, so it's obviously the big buzzword at the moment. And like all intelligence is that, it needs to be measured on how effective it is. We are using it quite significantly. And so to give an analogy a little bit of how we're using AI is, if I could use, like you often use a car analogy. So we'll all remember our grandfather who, before he drove to town, used to check the oil in the water. So that's what I call a manual process. And he kicked the tyres and checked the car is it going to make it to town? I now sort of say to, I've got 4 kids, is that half of them probably don't know how to open the bonnet, let alone check the oil. So what's changed is that we've advanced and put sensors in the car that comes to a dashboard that creates the alert. So Talius, and so like a car is that everyone's got different cars, those car manufacturers aren't making those sensors. So they're coming from Siemens, Bosch, wherever. But what they do is they aggregate them together to create the alerts. Now, what we have found as we've progressed this isn't obviously a part of what Statham, we're excited about you coming on as a partner with your clinical experience, was the information that we're now presenting is that we noticed, for example, last night that this resident didn't sleep well, so they slept for 6 hours while they normally sleep for 9. They went to the toilet 7 times more, where they normally go 3. They haven't got up this morning for breakfast and they haven't had their medication. Talius has detected that like a car would as a light. Yeah, sometimes we obviously know in our car that we have to go out and check the oil. In this information, it is quite powerful for a clinician to look at that, and they'll understand very quickly that this is wrong. But because we haven't got those resources, this is where the AI is coming in. The AI is analysing the clinical data and actually providing the questions and the evidence, and also making a recommendation to that carer to inquire or investigate what might be more underlying to there. The other parts on AI is I don't think, we're all using ChatGPT and we're all thinking how this is amazing and it's really impressive. What we're excited about with Talius is that we think we can cut the AI, the data up, because we're really a massive data repository. And so I can take the sleep data and put that into an AI, and I can take the heart rate sleep data. And we're seeing some amazing innovations. So a company, a university in Japan, has been doing research on, and Will, you'll know this better than I do, but a lot of people die of a heart attack in the early hours of the morning.
Yep.
They have found a simulation is that of if your breath rate and heart rate drop from 2 to 6 a.m., that you are, I don't know exact numbers, but you are 80% more at risk of a heart attack in the next 90 days. So that's where I'm coming from, is prediction to get that checked out so that person doesn't end up in an emergency department. And yeah.
You go back to the challenges of the health industry, and we hear it all the time, Will, don't we? And how do we get more nurses? How do you solve the workforce issue? And there's an element of what we do around attraction to the regions. There's an element around upskilling and bringing more clinicians to the table. But there's an element of we need to become more efficient, and an element of we need to actually free up the beds. So going back to the free up the beds and the more efficient process, that's effectively what Talius is doing, isn't it? It's freeing the beds up and it's making workforce more efficient to get more out of the workforce that's currently there and getting them to do the more high value tasks. And that's what you're talking around with the prediction models.
Spot on.
It's pretty exciting, yeah.
Well, I think there's also 2 parts to that is that why are they leaving? And why doesn't anyone want to come? So it's great that your work you're doing about attracting people to this space. And it's a very noble profession. And I find a lot of it is that it's the compliance and the governance that we've implemented because of the fear that's going people. It's like, I'm always looking over my back. I can't do my job. I'm spending 30 to 40% of my time writing notes about what I'm supposed to be doing or what I've done instead of doing it.
Yeah.
I don't know about anyone, if you brought these type of things into other industries, you'll have exactly the same effect. And so what Talius does is through the sensor data is significantly reduce that requirement. So I don't need to say a couple of use cases. So in aged care, we have a special sensor that is uses a magnet that attaches to the bed. Current business model is staff rounding. So every 3 to 4 hours, every night, the nurse is to go into every room and check if the resident is in bed, asleep and alive. Now that's a compliance and governance piece, which is great. Seems like a great idea. It's come from hospital and is now in aged care, which is a pretty flawed model. So the idea is that, one, you're now disturbing the resident's sleep. Secondly, the staff are doing the same thing 4 times a night, every night for the last year, which then creates complacency around the familiarity. And the thing is that we haven't got any real data out of it anyway. So with this sensor, we're saying is that you can now sit in the nurse's station. You don't get the night off because the sensor will show that every resident's in bed, asleep, breathing and alive, 24/7. So your current model would take 8 to 9 hours of labour and you'd have 3 minutes of data per resident. You've now got a sensor that would have an ROI in about 6 days that's continually monitoring it. It doesn't, I know this seems like, well, that just seems like common sense, but this is the challenge that we're facing but we've always done it this way.
Yeah.
This is the adoption.
It's going on that the innovation barrier of people to adopting is phenomenal. And a real example is we've presented around to a health provider around a software platform, TrendCare. Good platform, does a good job. When you identify the efficiencies that can be used by getting the sensor data and putting it through TrendCare, the barrier that I experienced firsthand, that no, TrendCare is really good. Well, it is really good, but you physically got to put the data in there. And if you can have that manual process automated, it's going to be better and faster. But yet the barrier of health institutions to adopt that, is it common across industry, do you think?
I haven't seen an industry as tough as this one.
Yeah.
So obviously I've had some experience of doing a lot of innovation across other industries. And, a couple of examples is one that I actually find is quite similar is that, for anyone who remembers in the 90s, security guards used to put little pieces of paper in the door to see if you've been broken into. That was sounds a bit like a spot check in a aged care home. And they would actually come 3 times a night and put a piece of paper in the door. It never stopped anyone breaking in. They would just wake you up in the middle of the night and tell you you've been broken into. So what has happened or changed is that became so cost prohibitive, it wasn't effective. So the industry said, well, you need something better because I'm still getting broken into. I'm spending $1,500 a week on a security guard. This is crazy. So we put a sensor that was on there 24/7. And then we identify and create a proactive alert to a responder to come and check it. So that's one example of an industry so no one sees the pieces of paper anymore and no one even sees security guards. Obviously video and artificial intelligence and video has changed that as well, but no one wants that in their home. No one wants that in their hospital room or their residential aged care room, which is understandable. So we just utilise other sensors that collect that data in a different way.
I want to keep talking about the change management process in a second, but I do want to just circle back to what you were talking about before, which is the efficiency that brings, and it's a double benefit. When we're talking about workforce shortage, the double benefit being, and probably I should also say the caveat is we're not suggesting that this is replacing people. This is bringing efficiency to a system on reducing the manualness of some of these tasks. So the double benefit for me would be that you get more efficiency in the tasks that are required. So fewer labour hours required for the tasks, which means you can divert those labour hours to more yield or higher yield, meaningful tasks. The second part of that double benefit is, talk about workforce attrition. Anyone who I've ever seen resign or reach burnout, and I don't say that lightly, are the type of people who come in and they're consistently giving 100% but not achieving 100%.
Correct.
And over time, that will wear even the best workforce down to the point that they feel like that they have to leave their position because they're not contributing meaningful work, not for lack of trying. So having these more efficiencies in their job and their tasks means that satisfaction and meaningfulness of their job goes up and you reduce attrition. So I can see a double benefit of why this would help. I want to come back to the, affecting change in any industry, but the sense you said is that the healthcare industry seems to be a little bit more averse to to adopting that change. I don't know if you've got a exact reason for this. Is it litigious reasons? Is it nostalgia or sentimentality that people hold on to tradition? What's the barrier?
I think they've all had technology that hasn't worked in the past, and so that becomes a concern. Is that
skeptical?
I think also is that, like, everyone talks about they want change, but no one personally wants to go through the process. And so that's been a big part of what we've been trying to develop is that you can't implement technology that creates any more work. It has to remove work. You might say the technology is better and it's going to do a better job, but if it creates more work on an already overburdened workforce, you're going to have a lot of pushback. I would say there's probably been a couple of little things that have been a problem, like particularly in residential aged care, a lot of them didn't even have Wi-Fi until a couple of years ago. And that was pushed through, and I'd probably say a lot of the change that we've seen has been implemented has been actually government-led. So they actually forced aged care to implement electronic medical records. So we're only talking like in the last 12 months, they've actually moved from pen and paper to electronic medical records. To implement that, they needed Wi-Fi. And so some of the technology that we've done is that what we've been used to in our business environment is Wi-Fi everywhere. We're talking 18 months ago, they didn't have any. Like, it's just insane. So they're still using paper-based systems. We see then the other part is the staff turnover is a huge, huge challenge. So you've trained and implemented this technology within 12 months, you could have nearly an 80% turnover of that site. So it's a complete retraining and re-implementation of all that. So, yeah.
And that's we see a lot of that, Graham, from our workforce division, that a number of nurses come because they're burnt out and they want work-life balance, and they're happy to work where they are or not, and they want to have the flexibility to work wherever they want, when they want, and get that balance. So it seems the irony, I suppose, that we're actually trying to stop that from a Statham point of view comes to our why, that we're trying to increase the livability of our regional centres by improving the sustainability. And if we can take that clinical compliance and that love for the workplace and give that back to the workplace, and they retain their staff, then everyone wins. And that's, it seems counterproductive from a Statham point of view to try and reduce the agency cost in a facility, but that's effectively what we're trying to do, to make it a better place to work and make them more profitable, which, again, I always say profit in health isn't a bad word, because if you're not making profit, you can't help anyone.
Absolutely. It's all profit for purpose.
Yeah, 100%. So when you're talking to, if you had the ear of government or CEOs or industry change agents, I suppose, what would you be asking them, or what ask would you make around how you can improve the system?
Well, the government is trying to, and you can see that what's happened out of the Royal Commission. They have put a number of measures in place and it's the old adage, you can't improve what you can't measure. And what Talius does is allows them to measure for the first time. Now, as we talked about, there's a lot of data already there. Now, we're finding is that they're so busy that they're not actually utilising the data that they're collecting. They're not actually using it. And I use an analogy saying that, we're giving them the P&L of their business, the profit and loss, and they're not even looking. We're just doing, the best we can. And the best we can is sort of like a all care but no responsibility. Now, I'm not saying they're not being responsible. It's just, yet again, is that, to give you an example of, to your point around the profit, like I wanted to give you a real case, that sleep sensor that we've implemented, we did it for one site. So 139 bed aged care home, within 4 months. So we monitored before we put it in, we monitored after we put it in. We had a 20% reduction in labour required to do the rounding because the sensor was doing it. We had a 24%, I think it was, of people reduced getting out of bed at night time. So the thing is, if I don't come into your room 3 times a night, I don't wake you up, so you don't get out of bed. Now, the thing is that we didn't expect is that we reduced falls by 24% because they didn't get out of bed to fall over. And the last one is that we got 80% better data of what was actually going on for that resident. Because we haven't got the continuity of care, we don't even know if they've slept badly or was the medication working. All of these other compounding issues. But so we then said, let's take that one staff member from the nighttime shift and move them to the morning shift, where we noticed all the skin tears were happening because everyone was rushing. So we were able to reduce falls and reduce wound management with a sensor that took a week to pay off. So what is the barriers? It's education about what is possible and what can be done. So the implementation of this is that I travel all over APAC every week, Sydney next week, Melbourne the week after, meeting aged care executives and educating them about IoT sensors, what they can do and how we can actually improve their operations. Once we get past the initial barrier, it is quite exciting to see the care teams go, this is going to make my life easier. I don't have to do as many notes. I don't have to do these, boring tasks. They actually feel a little bit more protected because there's a lot of, I've gone and seen mum and she says that you're not doing this and you're not doing that and you're not doing this, which creates the investigation, and the staff members feel like, well, I am doing that. 80% of the clients have got some level of dementia, so they've done, they don't know how they feel.
Yeah.
So this information just gives you the real data.
And that's touching on the clinical benefit, right? The downstream benefits to the residents and the patients. We've talked about the efficiency benefits and the staff satisfaction benefits, which equates to $1 saving. As we're recording this, the Aged Care Act has been postponed, but is due to go live with its effect on November 1 of 2025. And arguably the biggest change in amongst that, I think, will be in the community care space, those who are on support packages, and the compliance to those strengthened standards, I think, is what's keeping a lot of executives and senior leadership teams up at night. Talius, just double down on that clinical compliance space, almost immediately helps meet pretty much every standard.
Yes. I think we meet, 9 of the standards in the residential aged care and all of the ones in the new home care standards. As you're saying, is that the problem for executives is that they have no visibility.
Yeah.
They don't even know if their clients are alive or dead. And they're completely relying on the information that's being provided by, in a lot of cases, team members or staff members that are under a lot of pressure and they can miss things. So to come back to your big part is that Talius is about giving the visibility to obviously get the right person, the right place, the right time. I also agree is that community care is going to change dramatically. So as we started is that there's not enough hospital beds. We're already at 110% capacity and we haven't even started the ageing population. There's not enough residential aged care facilities. I think they take around 6 to 7 years for a DA, so there's no way we're going to be able to build them. We are going to be hospital in the home, and this is going to compound.
Yeah. And probably one of the best things I've seen is that the Talius options thread the needle very well of giving that visibility and solace that the person has a pretty low baseline, but they're alive, but they're well, and that their clinical indicators are being met. But the needle threading exercise is also not overstepping and having a interruption to the person's privacy and confidentiality and dignity. So we're not suggesting, full-blown cameras as these products. These are sensors that can pick up patterns, have a baseline specific to the individual, and much to what we were talking about earlier, having AI and algorithms involved that actually say, hey, this person is deviating from their baseline. We're just triggering a proactive response to go and have a look and assess them and intervene if necessary.
Correct. That also then allows us to use all of the allied health services. So to Jaden's question before, the government is actually very aware of this. You know, what is about $5,000 a day for a hospital bed, $1,000 or a bit under $1,000 a day for a residential aged care. So they were like, if I can keep people at home as long as possible, that is a huge saver for the government. So the government, with these new supported home rules, have actually implemented a assistive technology funding arm just for this technology to go in. Like they obviously can see what it can do. And if we can get that visibility, the providers from there can also then utilise the allied health services to support the person at home and also to move them through the packages system with real data to move them from a package 2 to 4 to 6.
And every jungle drum is beating in that direction that I hear as well. And to your point, blindly building hospital beds or aged care beds, particularly in rural and regional spaces, is not going to be the answer. We have to figure out innovative ways to look after people in their home. I want to lead on to the future because I think we've framed the problem nicely and what Talius adds as a solution. What I want to try and crystal ball a little with you is what trends are you seeing in digital health and workforce models or technology that are going to have impact on the sustainability of regional healthcare? And also, you know, what untapped opportunities as well do you see there that perhaps you're moving into?
The one that's disappointing for me is we have used, like, you know, obviously after COVID, we all went to Zoom, Teams, Google Meet, all of that. And the great thing is that we've continued with it, except for healthcare. They just implemented the technology, we're using it very well and putting it out there, and then as soon as it was finished, it's very quickly just gone again. To me, is that the biggest area that we need to implement and adopt is telehealth, which is going to be just crucial for regional and rural areas. Is that you've got the tyranny of distances is the biggest problem for us. Of we can't get a doctor there. We've got people driving from, you know, Quilpie all the way to Brisbane for specialist appointments, which is a huge toll on them health-wise. Going to waiting rooms where they're going to get infections with other things. And is that, you know, I can't believe, like, it will come back because it will be forced to. I see a business model in the sector that's holding on to labour hours. They're going, I need to bill as many hours as I can so I can get the money from the government. They're not utilising or thinking it smartly and going, okay, this carer can do 6 home care visits today. 80% of that time will be spent in logistics and driving to the site, and we'll have 20% of care. If they actually use the technology, we could actually do 100 visits by telehealth from an office and make more money than we did on the 6. But they're just not, you know, utilising the data and the technology to facilitate it. You know, I'm not saying that there's a lot of value in that person having this face-to-face. I'm just saying that we need to reframe it. And so I've often said, if you came to me when I'm 90 or 85 or whatever and said, I want to look after your home care, we're going to do 4 visits a day through telehealth and check on you. We've saved 4 hours of labour in doing that, and we'll come and pick you up on Friday and we'll take you out for 3 hours. So would you prefer 15 minutes of a rushed visit or 3 hours of quality time? And that's the example where you're not changing or using technology to diminish the care, you're actually empowering it, I believe.
Yeah, and without getting into that trench, more of a comment than a question, if COVID taught us anything, we can mobilise on mass scale to problem solve.
Absolutely.
And I think the crisis at the moment has changed from pandemic to workforce or efficiency, or in this case, it's the underlying manual process, which is, you know, creating all these ripple effect problems. So it's sad if it has to reach crisis point for us to mobilise en masse, but we know we can do it.
Yeah, and like we are working with some really innovative early adopters that are actually seeing this as an opportunity. like, you know, I don't want to get on the bandwagon about this, but it's like, you know, it's been tough in healthcare, hasn't it? Like for particularly aged care, we've gone through just hell of COVID. Then we've gone through the Royal Commission and then changes after changes and delays of laws and so forth. It's just been 4 years of just continual.
And the reality is there's no metaphorical big red button out there that we're going to press and reset everything to 2018, 2019. So
No.
it's going to be innovation and it's going to be technology. I agree with you in my opinion that is going to solve this, and Talius is an enormous leap, I believe, to make this happen. We're incredibly appreciative of your time, Graham. I just want to wrap up by asking, is there any closing comments or thoughts that you wanted to add that we haven't touched on?
No, well, thanks very much for inviting me along. I think it's been great. Yeah, and I think, you know, what you guys are doing is really a big part of what is needed to educate and communicate that there is another way. And, you know, I think collectively, is it to your point, Will, like everything we've done, you start with one thing. And, you know, if we do one thing in 100 days' time, this is very different to where it is now. And if we just start with one piece of data and how we use it, and then the second piece and the third piece, to the car analogy, there was one red light saying there's something wrong with your car. Now there's like 47 lights there. So same concept.
Graham, it takes courage to innovate, and courage to innovate in healthcare with your own dollar. So, mate, congratulations and thank you, and it's been a pleasure.
Thanks, Jaden. Thanks, Will.
Thanks, mate.
If you operate a health facility on the Darling Downs and you want more information on how Talius can help you, feel free to call the Statham office on 4589 0000 and ask for Jaden or Will.
Stay connected with the conversation about enhancing livability through sustainable healthcare solutions for regional Australia. Visit statham.com.au/podcast to learn more, connect with us and join the movement towards a healthier future for our regional communities.